Objective: provide essential knowledge and practices that ensure a safe and healthy environment for both caregivers and clients. Each lesson focuses on an important aspect of caregiving safety. Lesson 1: Effective cleaning and disinfection practice. Lesson 2: Safe handling of household chemicals. Lesson 3: Protecting other. Stay home when sick. Lesson 1: Effective cleaning and disinfection practice. Objective: teach proper cleaning and disinfection methods to eliminate harmful germs and pathogens, preventing the spread of infections in caregiving environments. Cleaning and disinfection. Cleaning involves removing visible dirt, dust, and organic material, such as grease or food particles, from surfaces using water, soap, or detergents. This process is essential for reducing the overall amount of debris and contaminants, but it does not kill or eliminate harmful germs, bacteria, or viruses. Essentially, cleaning lowers the germ load on surfaces, creating a cleaner environment, and enhancing the effectiveness of disinfection processes. By removing organic matter, cleaning prepares surfaces for disinfection, as many disinfectants are less effective when there is visible dirt present. Cleaning and disinfection. Disinfection is the process of using chemicals, disinfectants, to kill or inactivate harmful germs, bacteria, viruses, and fungi on surfaces. Disinfection should always follow cleaning, as it doesn't remove dirt or debris, but kills germs and pathogens. It's important to ensure that the disinfectant is applied for the correct contact time, and that it's effective against the specific pathogens present. The goal of disinfection is to reduce the risk of infection by eliminating pathogens that cleaning alone may not address. Cleaning and disinfection. It's important to check disinfectant labels to confirm they are effective against the specific pathogens you're targeting, whether they are viruses, bacteria, or fungi. Lastly, ensure the area is well ventilated, especially when using disinfectants that may release strong fumes. Before beginning the cleaning and disinfection process, gather all necessary supplies. This includes cleaning agents, such as soaps or detergents, approved disinfectants, and personal protective equipment, PPE like gloves and masks. You'll also need cleaning tools such as cloths, sponges, or disposable wipes, along with buckets and mops if needed. Start by removing visible dirt and debris using a damp cloth, or mop with soap or detergent. This step helps reduce organic material, which can shield germs from disinfectants. Focus on high-touch surfaces like doorknobs, light switches, handrails, phones, and bed rails, as these require more frequent cleaning and disinfection. When cleaning, always begin with less soiled surfaces, and move to dirtier areas to avoid cross-contamination. This approach ensures a thorough cleaning process while preventing the spread of germs. Frequently disinfect high-touch items like doorknobs, light switches, and phones. ideally after each use or multiple times a day in high-risk environments. Disinfection process. Once you've cleaned the surface, apply the disinfectant according to the manufacturer's instructions. It's crucial to ensure that the disinfectant remains on the surface for the recommended contact time, usually 1 to 10 minutes, depending on the product and pathogen. This contact time is essential for the disinfectant to kill or inactivate harmful germs. Be sure that the surface is thoroughly wetted, as this allows the disinfectant to fully cover and treat the area. Avoid wiping or drying the surface immediately. Let the disinfectant sit for the recommended time to maximize its effectiveness. Only wipe or allow it to air dry once the contact time has passed. This process ensures pathogens are properly eliminated, reducing the risk of infection, and creating a safer environment. Choosing the right disinfectant for infection control. To effectively eliminate harmful pathogens, it's important to select the right disinfectant based on the type of germs you're targeting. For viruses, example, influenza, SARS-CoV-2, look for disinfectants labeled as effective against viral pathogens. For bacteria, example, MRSA, C. difficile. Use products that specifically mention their ability to kill bacterial strains. When dealing with fungi, example, Candida species, make sure the disinfectant is designed to eliminate fungal infections as well. Always check the product label for specific claims of effectiveness against the pathogens you're addressing. Using the right disinfectant ensures you're tackling the exact risks present in your environment, helping to reduce the spread of infections and maintain a safe, hygienic space. Personal protective equipment, PPE. Always wear gloves when cleaning and disinfecting to protect yourself from exposure to chemicals and germs. If using disinfectants with strong fumes, especially in confined spaces, masks and eye protection are essential to prevent inhalation and eye irritation. After cleaning, dispose of gloves and other disposable PPE properly, to avoid cross-contamination and maintain a safe hygienic environment. This ensures both your safety and the safety of others in the caregiving space. Safety precautions. Always follow the manufacturer's instructions. Adhere to recommended dilution rates, proper application techniques, and specified contact times. To guarantee the products work as intended, do not mix chemicals unless explicitly directed by the manufacturer, as combining different cleaning agents with disinfectants can create toxic fumes or even dangerous chemical reactions. Store all cleaning and disinfectant products in their original containers, clearly labeled to prevent accidental exposure. Always keep cleaning products in well-ventilated areas, and never transfer them to unlabeled containers. These precautions will help ensure the safe and effective use of cleaning agents, protect your health, and minimize environmental risks. Hand hygiene is essential. caregivers and patients should wash hands frequently, or use hand sanitizers, especially before and after patient interactions, or touching surfaces and equipment. Proper waste disposal is crucial to prevent cross-contamination. Contaminated cloths, gloves, and PPE should always be disposed of in sealed bags. To reduce the risk of spreading harmful pathogens, these additional steps help create a safer, healthier environment for both caregivers and patients, minimizing the potential for infection. Lesson 2. Safe handling of household chemicals. Objective: educate the safe use and handling of household chemicals to protect both caregivers and clients from harmful exposure to toxic substances. Household chemicals, such as cleaning agents, disinfectants, and air fresheners are essential for maintaining hygiene, but can pose serious health risks if not handled properly. In caregiving environments, it's crucial to caregivers and clients know about the safe use and handling of these substances to protect everyone from harmful exposure. Maintaining a sanitary environment prevents illness. Clean and disinfect surfaces with a sanitizer like bleach following the manufacturer's instructions. Read labels and follow instructions. Before using any cleaning or disinfecting product, it is essential to read the label carefully to understand how to use the product safely and effectively. The manufacturer provides crucial information, such as proper usage instructions, dilution ratios, and recommended contact times. These guidelines help ensure the product performs as intended and maximizes its effectiveness in eliminating pathogens. Pay special attention to warnings and precautions on the label, which may include specific safety measures like the need for proper ventilation or the use of personal protective equipment. PPE such as gloves, masks, or eye protection. This is especially important for products that release strong fumes or contain chemicals that could irritate the skin, eyes, or respiratory system. The label may include first aid instructions for accidental exposure and information on how to store the product safely, as well as how to dispose of it properly. Ensuring that you understand these instructions reduces the risk of accidents and ensures a safe cleaning and disinfecting process. Product labels not only show hazard warnings, but also provide important emergency treatment information. Always check the label before use to understand the toxicity or hazard level. Labels may include caution, could irritate skin, eyes, or cause illness if inhaled. Warning, higher risk of sickness or injury with improper handling, may be flammable. Danger, serious risk that requires extreme caution. Improper use can lead to severe illness. Use personal protective equipment, PPE, when handling household chemicals. Caregivers should always wear appropriate PPE, such as gloves, masks, and eye protection. Some chemicals, like bleach or ammonia-based cleaners, can irritate the skin, eyes, or respiratory system. By using gloves and masks, caregivers reduce their risk of chemical exposure and can protect both themselves and the clients they care for. Proper ventilation. Many household cleaning products release fumes that can be harmful if inhaled, especially in poorly ventilated spaces. Proper ventilation is crucial when using chemicals to prevent the buildup of toxic fumes. Always ensure that the area is well ventilated, particularly in confined spaces such as bathrooms, kitchens, or any small rooms where airflow may be limited. Open windows. Use fans, or if available activate exhaust fans to improve airflow and help disperse the fumes. By increasing ventilation, you reduce the concentration of harmful chemicals in the air, lowering the risk of respiratory issues, chemical irritation, or even poisoning. This protective measure is essential for both caregivers and clients, ensuring their health and safety while using cleaning or disinfecting products. Store chemicals safely. To ensure the safe storage of cleaning agents and chemicals, always keep them in their original containers, which should be clearly labeled with the product name and safety instructions. Store them in a cool, dry place, away from sources of heat or moisture. Never transfer chemicals to unmarked or alternative containers, as this can lead to confusion and increase the risk of accidental poisoning. In healthcare settings, it is especially critical to store cleaning chemicals separately from food, medications, or medical supplies to prevent contamination. Proper storage practices not only help keep the environment safe, but also ensure that chemicals remain effective and ready for use when needed. Never mix cleaning products. Mixing household chemicals can be extremely dangerous, as it may result in the formation of toxic gases, flammable substances, or other hazardous reactions that pose serious health risks. For example, combining bleach with vinegar can produce chlorine gas, which can cause coughing, breathing difficulties, and irritation to the eyes, nose, and throat. Similarly, mixing hydrogen peroxide with vinegar creates peracetic acid, which can be corrosive and irritating to the skin and respiratory system. To avoid such risks, always use one chemical at a time, and follow the manufacturer's instructions carefully. If a product advises dilution, ensure you follow the correct ratios to prevent excess concentration, which can lead to dangerous fumes or irritation. Never combine products unless it is explicitly stated on the label that it is safe to do so. If you're ever unsure, it's safer to stick to a single chemical for each cleaning task. Do not make the solution stronger than recommended. In case of accidental mixing or exposure to harmful fumes, it's essential to immediately leave the area and get fresh air, and if necessary, contact a poison control center or emergency services. Taking these precautions not only keeps you safe, but also ensures that you're using cleaning agents effectively without creating unnecessary hazards in your environment. Proper disposal of chemicals. Never pour leftover cleaning agents or chemicals down the drain, or dispose of them in regular household trash unless the label specifically states it's safe to do so. Improper disposal of cleaning products can lead to environmental contamination, affecting water sources, soil, and wildlife. Harmful chemicals can seep into the water supply or disrupt ecosystems, posing risks to plants, animals, and even humans. Always follow local regulations for the disposal of hazardous waste. Many communities provide designated drop-off locations or collection events for the safe disposal of chemicals, ensuring they are handled in an environmentally responsible way. These locations may accept items like cleaning agents, pesticides, solvents, and other household chemicals. By adhering to proper disposal methods, you help protect the environment and reduce the potential for harmful exposure to hazardous substances. Always check with your local waste management service for specific guidelines and drop-off points. Immediate action for accidental exposure. Despite taking all necessary precautions, accidents involving chemicals can still occur. Knowing how to respond promptly can significantly reduce the risk of serious harm. If a person comes into contact with a chemical, always follow the first aid instructions on the product label. This may include actions such as rinsing the affected area with water, removing contaminated clothing, or applying specific treatments. If someone inhales fumes, it's important to move them to fresh air immediately. If they experience difficulty breathing or show signs of respiratory distress, seek emergency medical help right away. In the case of chemical exposure to the eyes, rinse them immediately for 15 minutes, ensuring to open your eyelids wide to allow the water to wash away particles. This quick action is essential for minimizing eye damage. Using a shower for rinsing can help you wash thoroughly. If ingested, do not induce vomiting unless directed by a healthcare professional or poison control. If you come into contact with chemicals, it's crucial to act quickly to minimize harm. Immediately wash or brush off powders, liquids, gels, or pastes. Then rinse the affected area with a large amount of water. Always remember, medications are potent chemicals and should be handled with care to avoid accidental exposure. In any case of accidental exposure, whether through skin contact, inhalation, or ingestion, seek immediate medical attention, or you can contact the Poison Help hotline at 1-800-222-1222 or visit the American Association of Poison Control Centers website at www.aapcc.org, providing prompt, accurate information about the chemical involved will help healthcare professionals provide the best care. If you're unsure about the chemical, experiencing significant symptoms, or feel it's a serious situation, get medical attention immediately. Go to the emergency room, call your healthcare provider, or dial 911. Lesson 3. Protecting other. Stay home when sick. Objective. Emphasize the importance of staying home when sick to avoid spreading contagious infections to clients, especially those who may have weakened immune systems or frailty. Protecting the well-being of clients. Staying home when you're sick is a fundamental step in ensuring the well-being of clients, particularly those who are most vulnerable, such as the elderly, individuals with chronic conditions, and those undergoing treatments like chemotherapy. Even a mild illness in a caregiver can escalate into a life-threatening situation for these clients, whose immune systems may be compromised. This is particularly important in settings like hospitals, nursing homes, or in-home care, where clients may already be weakened by other medical conditions or treatments. Protecting the well-being of clients. Protecting clients from exposure to infections is not just a matter of reducing illness. It's about enhancing their overall quality of life and recovery outcomes. Staying home when sick is a simple yet powerful act that plays a critical role in protecting vulnerable clients and ensuring that caregiving environments are as healthy as possible. Reducing the spread of infections. In addition to protecting vulnerable clients, staying home when you're sick also plays an essential role in infection control. It prevents the potential spread of illness to coworkers, other clients, and individuals in the caregiving environment. This practice also reduces the risk of outbreaks, ensuring that the caregiving environment remains stable, safe, and effective. By staying home when unwell, you actively support infection control protocols. Taking this responsible action ensures that everyone in the caregiving environment remains safer, minimizing disruptions and health risks for both clients and staff. Protecting vulnerable clients from infection. By staying home when sick, caregivers play a crucial role in preventing the spread of infections to their clients, particularly those with weakened immune systems or chronic health conditions. Vulnerable individuals, such as the elderly or those undergoing chemotherapy, are at higher risk of complications from even minor illnesses. A seemingly mild cold or flu for a caregiver can quickly escalate into a serious health risk for these clients. Staying home allows caregivers to protect their health and ensures that clients can recover in a safer, healthier environment, free from the added threat of infection. This practice not only supports the well-being of clients, but also contributes to the overall safety and stability of the caregiving environment. Prevents burnout and long-term illness. When you're sick, pushing through and working can prolong your illness, making it harder for you to recover, and potentially leading to burnout. This not only impacts your well-being, but also your ability to provide the high-quality care clients depend on. Taking the necessary time to rest and recover when you're unwell ensures that you return to work fully refreshed and ready to give your best care without risking your health or the health of others. Promoting a culture of responsibility. Staying home when sick promotes a culture of responsibility within the caregiving community. When caregivers prioritize their health and take the necessary time off when unwell, it sets a positive example for others. This helps foster a sense of collective responsibility, where everyone is invested in maintaining the health and safety of the workplace. When caregivers choose to stay home when sick, they contribute to a culture of health and responsibility that benefits both clients and staff. Staying home when sick helps maintain a safer environment for both clients and staff. It fosters a culture of responsibility and infection control within caregiving organizations, where everyone's health is prioritized. Maintaining a safe and healthy environment. By staying home when sick, you help maintain a safe and healthy environment, reducing the risk of infections spreading. Taking this simple, yet highly effective step is essential in infection prevention, and ensures the overall well-being of everyone involved in the caregiving environment. By staying home, caregivers reduce the risk of transmitting illnesses, allowing clients to recover in a safe and sterile environment that promotes healing without additional health threats. By minimizing exposure to infections, caregivers create a healthier environment, where clients can focus on their recovery without the added stress of contracting another illness. Ensures uninterrupted care. By notifying your supervisor and making arrangements to find a replacement, you help ensure that clients continue to receive the care they need without interruption. This prevents the risk of neglecting client needs due to staff illness. This reduces the chance of an illness spreading further within the caregiving setting, ensuring that care continues without the added risk of contamination. By preventing the spread of even mild illnesses, caregivers help maintain a steady and uninterrupted recovery process for their clients. Notifying your employer. When you're sick, it's essential to notify your employer or supervisor as soon as possible. This allows them to make the necessary arrangements, such as finding a replacement caregiver or adjusting schedules to ensure that clients continue to receive proper care. Early communication helps prevent disruptions in the caregiving process and ensures that clients are not left without support. Reduces risk of spreading infections. By staying home when you're sick, you minimize the risk of spreading germs to coworkers, clients, and other individuals in the caregiving environment, significantly lowering the chances of an outbreak within the facility. It allows clients to recover without further health threats, and it minimizes the potential for the illness to spread within the caregiving environment, helping maintain a safe space for both clients and staff. Staying home when sick prevents the possibility of spreading infections, ensuring that care continues without the added risk of contaminating others. Notifying your supervisor. When you're feeling too unwell to work, ensuring that you communicate effectively with your employer is critical for both your well-being and the continuity of care for your clients. As soon as you recognize that you're too sick to fulfill your duties, it's essential to notify your supervisor or another designated person at your workplace immediately. The sooner you provide this notice, the better prepared your employer will be to make any necessary adjustments, such as arranging for a replacement caregiver, or shifting the schedule to ensure that the care provided remains consistent and uninterrupted. This helps avoid any gaps in care, which is especially important in caregiving settings, where clients depend on continuous attention and support. Notifying your supervisor. Notifying your supervisor promptly also demonstrates professionalism and responsibility. It allows your team to react quickly and address any staffing shortages without scrambling at the last minute. This proactive approach keeps the caregiving environment stable, safe, and well organized, even when someone is unexpectedly absent due to illness. Congratulations! You finished Module 9. Please complete the quizzes. Congratulations! You finished Module 9.